Introduction. Separation anxiety disorder (SAD) is an anxiety disorder in which an individual experiences excessive anxiety regarding separation from home and or from people to whom the individual has a strong emotional attachment. Separation anxiety is a natural part of the developmental process, and it is common in infants and little children, typically between the ages of 6 to 7 months to 3 years, and although it may pathologically manifest itself in older children, adolescents, and adults. According to the American Psychiatric Association, APA, separation anxiety disorder is an excessive display of fear and distress when faced with situations of separation from the home and or from a specific attachment figure. The anxiety that is expressed is categorized as being atypical of the expected developmental level and age. The severity of the symptoms ranges from the anticipatory uneasiness to full-blown anxiety about separation. SAD may cause significant negative effects within areas of social and emotional functioning, family life, and the physical health of the disordered individual. The duration of this problem must persist for at least 4 weeks and must present itself before a child is 18 years of age to be diagnosed as SAD in children, but can now be diagnosed in adults with a duration typically lasting 6 months in adults as specified by the DSM-5. Causes: environmental. Most often, the onset of separation anxiety disorder is caused by a stressful event, especially a loss of a loved one or a pet, but can also include parental divorce, change of school or neighborhood, natural disasters, or circumstances which forced the individual to be separated from their attachment figures. In older individuals, stressful life experiences may include going away for college, moving out for the first time, or becoming a parent. According to the DSM-5, young adults with separation anxiety disorder have different examples of stress, including leaving their parents' home, entering a romantic relationship, and becoming a parent. In some cases, parental overprotectiveness may be associated with separation anxiety disorder. Genetic and physiological. There may be a genetic predisposition in children with separation anxiety disorder. Separation anxiety disorder in children may be heritable. Heritability was estimated at 73% in a community sample of 6-year-old twins, with higher rates in girls. A child's temperament can also impact the development of SAD. Timid and shy behaviors may be referred to as behaviorally inhibited temperaments, in which the child may experience anxiety when they are not familiar with a particular location or person. Low levels of child's effortful control and self-regulation, the ability to regulate one's emotional, sensory, and behavioral responses and impulses have also been shown to contribute to the development of SAD. Cures: medication. The use of medication is applied in extreme cases of SAD when other treatment options have been utilized and failed. However, it has been difficult to prove the benefits of drug treatment in patients with SAD because there have been so many mixed results. Despite all the studies and testings, there has yet to be a specific medication for SAD. Medication prescribed for adults from the Food and Drug Administration are often used and have been reported to show positive results for children and adolescents with SAD. There are mixed results regarding the benefits of using tricyclic antidepressants, which includes imipramine and clomipramine. One study suggested that imipramine is helpful for children with school phobia who also had an underlying diagnosis of SAD. However, other studies have also shown that imipramine and clomipramine had the same effect on children who were treated with medication and placebo. The most promising medication is the use of selective serotonin reuptake inhibitors in adults and children. Several studies have shown that patients treated with fluvoxamine were significantly better than those treated with placebo. They showed decreasing anxiety symptoms with short-term and long-term use of the medication. Exposure and behavioral therapy. Behavioral therapies are types of non-medication based treatment which are mainly exposure based techniques. These include techniques such as systemic desensitization, emotive imagery, participant modeling, and contingency management. Behavioral therapies carefully expose individuals by small increments to slowly reduce their anxiety over time and mainly focuses on their behavior. Exposure-based therapy works under the principle of habituation that is derived from learning theory. The core concept of exposure therapy is that anxiety about situations, people, and things does not go away when people avoid the things that they fear, but rather the uncomfortable feelings are simply kept at bay. In order to effectively diminish the negative feelings associated with the situation of fear, one must address them directly. In order to administer this treatment, the therapist and the anxious child might sit together and identify progressively intense situations. As each situation is dealt with masterfully, the child advances to the next phase of intensity. This pattern continues until the child is able to handle being away from their parent in a developmentally typical way that causes them and their caregivers minimal amounts of stress. While there is some controversy about using exposure therapy with children, it is generally agreed upon that exposure therapy in the context of SAD is acceptable, as it may be the most effective form of therapy in treating this disorder, and there is minimal risk associated with the intervention in this context. Contingency management. Contingency management is a form of treatment found to be effective for younger children with SAD. Contingency management revolves around a reward system with verbal or tangible reinforcements requiring parental involvement. A contingency contract is written up between the parent and the child, which entails a written agreement about specific goals that the child will try to achieve and the specific reward the parent will provide once the task is accomplished. When the child undergoing contingency management shows signs of independence or achieves their treatment goals, they are praised or given their reward. This facilitates a new positive experience with what used to be filled with fear and anxiety.